Hey, it's Jennifer. Today I want to talk about a common question we get from runners who are having shin pain. So is it shin splints or is it a possible stress fracture? So that's an important distinction because you would change how you treat either one of those. So a couple tips to try to help you in your decision making. So a stress fracture is going to be really tender in like a very pinpoint area. So if you can put like one finger on it and you're like, this is where it hurts, that's more likely stress fracture versus if you have like a 3-finger breadth or it's a little bit broader of an area that's tender, that's more likely shin splints or medial tibial stress syndrome. So the area that hurts is different between the two of them. A second difference is how they behave. So with a stress fracture, it's not going to warm up and go away, your pain. So it'll hurt during the run, all throughout the run, and then when you're done, it might feel better. And then as it gets worse, it's going to hurt during the run, it's going to hurt after the run, and eventually it's going to hurt with all weight-bearing activities. So goal is to not let it get that far. Compare that to shin splints or medial tibial stress syndrome. That's going to hurt when you first start running, and then it might warm up and actually feel better. And then depending on how far down the road you are, it might come back during the run. But there's that point where it kind of warms up and feels better and doesn't start hurting until later. And then once you stop running, it feels better. So a couple differences between those two conditions. So if you're questioning that you might have a stress fracture, X-ray is a good place to start. Also, just come in and we'll help tease apart these two conditions. Because it's important if you do have an injury to your bone, you want to unload that and let the bone heal, versus shin splints, we're wanting to increase your muscle capacity and kind of work through what running you can tolerate with some strengthening exercises. So different approaches, two very different injuries. Let us know if you have any questions. Thanks for listening. Bye.